Welcome, everybody, to The Art of Healing with your hosts, Dr. Judy Jasek of Animal Healing Arts and Matt Rowe of ParsleyPet. During our show, we are talking about your pet's health, raw feeding, and alternative treatments for cancer, unexplained illnesses, and supporting your pet's natural ability to heal. Welcome, Dr. Judy, to this week's show.
Thanks, Matt. Happy to be here as always.
Yeah, this is going to be an interesting show today because we hear so much about autoimmune conditions in human beings and how they're really just becoming more prevalent, how they're growing, and how a new one almost shows up every time we turn the corner. But could your dog have an autoimmune condition? I mean, let's start with that question. Can a dog get an autoimmune condition?
Oh, yeah. Not only can they, I think they do all the time. And I think it's not always recognized or it gets in conventional medicine. If something is recognized as autoimmune, the only approach in treating it is to suppress the immune system with things like steroids and cyclosporine and all sorts of much, much harsher immunosuppressive drugs. And I've seen a lot of dogs get really sick from these drugs. The immunosuppressive drugs sometimes are needed in the short term. So say your dog has one form of autoimmune disease is where the immune system attacks the red blood cells. Well, this becomes life-threatening in a hurry, and you have to stop that reaction. But what I also see is that in conventional medicine, they don't do anything to look at, well, what do we need to be doing to support the immune system so this doesn't happen in the future? And, why did it maybe happen in the first place? What set this off? And I think we need to be what I call modulating the immune system, where we're supporting it so it can do its job properly without overactivating it, because that setup where you have this, overactive immune system can present as anything from allergy symptoms to, really serious diseases where the immune system is attacking certain cells in the body, like red blood cells, where it could become life-threatening.
Absolutely. And when you look at a lot of this, the immune system is getting triggered by something in the environment. So due to the amount of chemicals in the dog's food, if you're feeding a standard kibble, then you're looking at chemicals there. You're looking at, what we spray our grasses with, the quality of our water. I mean, you're looking at so many of these other elements that I don't think any one of them as a singular could really fire it. But then you start stacking, as somebody told me, is you fill the toxic bucket, there's a point that it will overflow.
Right. And every pet is an individual biologically. So every pet could potentially react to something different. So you don't know, we've talked about over supplementing. When pets are on lots and lots and lots of supplements, all with multiple ingredients, sometimes synthetics, some chemicals, probably things you don't even know that are in there. And any one of those things could potentially trigger the immune system to react. It's just like in people. Some people have sensitivities to gluten. I'm one of them. I can't eat gluten without feeling sick afterwards, but not everybody does. Some people can't eat dairy. There's all these different sensitivities, and we have to learn to eat accordingly. I think in pets, there can be similar types of triggers. The tricky thing with pets is they can't tell us, hey, when I eat that, I get a little tummy ache after it. It doesn't seem like it agrees with me, because we get that signal and we say, maybe I shouldn't be eating that. Sometimes your pet can be exposed to things that don't necessarily cause a overt allergic reaction, but over time, it could contribute to autoimmune disease. And I think vaccines are a huge, huge culprit, because the development of an autoimmune disease that comes from disrupting the immune system with vaccine after vaccine after vaccine. Sometimes the symptoms don't show up till months later. The vaccine can disrupt the normal function of the immune system because we're giving these antigens and these toxins through an injectable form, which is not the normal way that the body would be exposed to these organisms out in nature. And so the immune system recognizes them and reacts to them, but doesn't always react appropriately. So that's why a few months down the road, we can have itchy skin, diarrhea, and again, even more serious skin disease. So there's a difference between, say, a mild allergic reaction, your dog gets a little itchy, and true autoimmune disease, where tends to occur in dogs at the mucocutaneous junctions. So that means where there's a mucous membrane meeting the skin. So we see a lot of autoimmune disease around the nose, these dogs with big crusty nose, around the eyes, sometimes around the anus, those areas, again, mucous membrane meeting the skin. Those tend to be sometimes in the ears. Those tend to be some of the most common areas for skin lesions to occur.
I mean, if you think about it from the vaccine side, I mean, the immune system is activating to fight off that antigen in the vaccine. So to create the antibodies necessary to make sure that dog doesn't get parvo or something that they're vaccinated for. But if we are vaccinating our dogs and all of a sudden the immune system is kicked into drive to go fight off that vaccine that's injected, and then on the same side, we're feeding kibble, so that's a toxin we're entering into the dog's body, then once again, the immune system is going to fight that toxin that you just entered into the body. Then let's say you do a frontline, or you do the flea and tick oil on the neck. And at that point too, the body is really wanting to protect that area. So now it's like the perfect storm we're putting together. And yeah, the immune system goes into hyperdrive. Well, when it goes into hyperdrive, it essentially doesn't know where to stop at that point, or where are the issues that I need to truly address when we're giving it so much to try to combat at once.
Yeah, exactly. It's like we have to re-educate it, because the immune system is amazingly adept at protecting the body. And the whole idea behind things like vaccines is to stimulate the immune system to make some antibodies against certain diseases. And then the pet should have protection. And that can work, but when they're overdone, like you were saying, Matt, the immune system just doesn't know whether it's coming or going. It doesn't know what's friend or foe anymore. It's just so reactive. And then we get so much inflammation in the body. And people will say, oh, well, my dog must have a food allergy or something like that. And those are actually quite rare. It's just that the body is so inflamed, and we have to calm down that immune system and then help support it so that it can do its job. And the biggest way to calm it down is not by just suppressing it. It's by getting rid of the inflammatory ingredients. So the inflammatory foods, such as kibble, the over-vaccinating, the heartworm, the flea and tick, all of these preventatives and supplements. So many pets are way over supplemented. I get, pets are really inflamed. I get them down to just a very, very basic minimal ingredient diet with just fresh foods, off of all supplements, off of all as many medications as we can, unless something is, medically necessary. Then we get a new baseline, and then we can start to do things to help support and modulate the immune system so that it learns how to do its job. But if all you do is suppress it, and then what tends to happen, and I'll see this, people's pets will get put on these immunosuppressive drugs to control, say, itchy skin. And it's like having your foot on a spring and you're holding it down, holding it down, holding it down. And then when we go to try to take the pets off of these, you take your foot off that spring and you can get a really big rebound reaction. So then pets get worse before they get better, but you have to ride that out at the same time supporting the immune system. There's things we can do to help support it, but you just have to ride that out and let the immune system figure out what the heck it's supposed to be doing in the body. Because the suppressive drugs, they're just that, they're just suppressing symptoms. And when all you do is suppress symptoms, you're driving that disease process deeper in the body. And I can guarantee it's going to pop up later as something even more severe, such as cancer.
Yeah, and the immune system, the body wants to stay healthy. Let's just go take a look at wolves. I mean, wolves are a 0.5% away, genetically from your dog. So wolves, you don't see them out there in the wild, and they're getting sick and they're doing all this stuff. So their bodies want to remain healthy, strong, thrive, repopulate, and continue to be a strong wolf pack.
Right. And they're not on the internet ordering a whole bunch of supplements and,
I mean, you don't have a pack of wolves that show up and want treatment?
No, it has not happened yet.
No.
It hasn't happened yet. I'm guessing the ones that aren't healthy, they don't have healthy immune systems, they just don't make it. So there's natural selection. But yeah, who's putting those wolves on antibiotics and things like that? Nobody.
You don't see a pack of wolves that have passed away. You don't see, a trail of wolves that have died, or, the carcass of a wolf that has been eaten. I mean, if that was happening, we would know it. And because that would come up as, oh my gosh, what's happening to this population of wolves that are being reintroduced into Colorado and Wyoming? So now with that, the wolf wants to remain healthy, but your dog is also that way too, is it wants to remain healthy at all times. And I love the analogy you give with your foot on the spring. But I think as we give supplements and we do this, it's almost like we're enabling the immune system. And what I think on that is enabling in a bad way is like, oh, you put that supplement in, I don't need to react right away. So whether something is happening where we're changing the dog inside and their immune system response is changing. So then when something big happens, so for example, a vaccine, flea and tick, bad diet, all these toxins that they're coming upon potentially on a walk, then the immune system is the only way it can respond is to overreact. And then all of a sudden, then under that overreaction, that's when you see 30, 60 days, 90 days down the road, the dog is starting to have some issues because we're not allowing the body to naturally remain in homeostasis.
Right. Or, stressors come up, like say, dog, and I actually do see this quite a bit. Dog has, round of the vaccines and flea and tick and springtime, people getting all geared up, getting all the spring maintenance done, and everything might be okay for a while. And then the family goes on vacation for 10 days and the dog's got a pet sitter. And so the dog is stressed, and then they come back and there's some symptoms. Well, those symptoms aren't necessarily because of something that the pet sitter fed the dog that they weren't supposed to. It fits for one place where people's minds go sometimes. It could have been back from all of those treatments, or, doing too many things at once. I see so many animals that get vaccinated. They go in for a surgery and the clinics require that they have vaccines. Vaccines have nothing to do with the surgery. And you're putting the pet through something. And surgery is stressful, sometimes necessary, of course, but it's an anesthesia. There's going to be medications. It takes the body a lot to process all of that. And then you're going to put a vaccine on top of it. It's actually going to prevent the body from properly processing all of those medications and just managing the stress of what's going on. So I think we have to be, really careful about what stressors are in our dog's life and how we time these things. If the dog's going to be given something that might stress his immune system, don't do it in conjunction with other potential stressors. Like so many dogs are vaccinated right before they go into boarding kennel because they're due for their vaccines, and the clinic or the kennel is more than happy to make sure that they get all their vaccines. And so they get all these vaccines, and then they go into this stressful situation for a week or 10 days. And it's so not healthy for the dogs.
Yeah. Amen. So what do you recommend that for all the pet parents that are watching the show, what do you recommend that they do? I mean, what is something that they can do to help, either if they think that their dog has an autoimmune condition, or to help prevent an autoimmune condition from arising? What are some steps that they can take?
Yeah. So the first one, diet, we talk about all the time, fresh food diet, get them off of the processed carbs. All processed carbohydrates are inflammatory and they're toxic. You know, we've talked about the glyphosate. I think the first step is not what do we do to treat the condition? It's what do we need to remove that could be contributing to the condition. So getting them off of the inflammatory carbohydrates, make sure we're not over supplementing, get down to just really medically necessary supplements. We can add things in later, back end later, but initially we want to just get to a new baseline, not an inflammatory diet. And we want to be minimizing things like vaccines and these other preventatives that we're talking about, and medications. I mean, any medication that a dog takes is going to affect his gut, which is going to affect his immune system and the ability of the immune system to function properly. And if your dog is, suffering from some form of autoimmune disease, and you start to make these changes, remember that it takes a while. We are literally re-educating the immune system. So especially if we're weaning them off of immunosuppressive meds, which sometimes we're doing, so we're pulling out the things that are inflammatory. I do have some Chinese herbal blends that I'll use that can help support the immune system. I really like the bioalgae products because it's really good whole food nutrition just to give those cellular building blocks. I do ozone therapy. I've used ozone therapy quite a bit to help treat patients with autoimmune disease. So we pull those things out, and we're watching the pet, and sometimes, things will get worse before they get better. They go through a detox. So if it's a serious type of autoimmune disease, we might need to have them on something immunosuppressive like a steroid while we're figuring things out and sorting things out for that individual, because we don't want them to progress to a life-threatening, situation. But then we start to pull them off of that as quickly as we can. And I've done this many times, and I've seen pets do really, really well getting the inflammatory items out of their diet and out of their routine and their environment as much as possible. And then just, so helping to gently support the immune system. And I've seen quite a few regulate where on the conventional side of medicine, people are told your dog's just going to be on these drugs for the rest of his life, which is going to be significantly shorter if they stay on those drugs.
Yep. Absolutely. So you're really just talking about getting the dog back to a baseline and removing or limiting the amount of toxic load that is going into the dog's body.
Right.
And really taking a look at and keeping an eye out, saying it's not that we have to do more. It's almost that essentially of doing less.
Right. Right. The right kind of support, but not just throwing more and more and more things at the dog, getting down to a more basic diet and a more basic routine. Think about where you're taking your dog, that they're not exposed to, weed killers and pesticides and things like that this time of year. I think a really, really big problem for dogs. That's a very big risk. And again, those herbicides and pesticides get in the gut, they severely disrupt the microbiome, which then has a direct link to the immune system.
Yeah. So if you're feeding a raw diet, so really the first place to start is diet. Like, really, what are you feeding them?
Yeah. So, it always is. It's like my treatment recommendations.
Yeah.
Across the board, the baseline is almost the same, regardless of what's going on, because we've got to stop the inflammatory ingredients.
Right. Absolutely. So get them off the food. And now anybody watching that's like, I've done that, but they're still on it. What medication are you giving? When was the last time they received a vaccine? Think of everything you've put inside of your dog's body, even down to the point of where do you walk them? If you're walking into a very green field and it's beautiful, chemicals were sprayed to make that happen.
Yep. Go walk them in the dandelions.
Yep. Go, yeah, and just brown grass, dandelions, and usually the ugly places to walk are the most healthy places. And your dog is a scavenger, so they're going out, they're trying to find all of these areas that are healthy for them, and they want to eat what's healthy for them, and they want to be healthy in their lives. So if we allow the dog to actually go have that moment in their life where their body can get back to a balance of homeostasis, this is ideal. This is what we want for them. Allow them to be a dog and allow them to thrive like a dog. You said something really important is as you start this regime, you might notice it gets worse because of detoxing.
Yep. The dog's body's got to kick out all those toxins and chemicals that have been accumulating. The body tends to hold on to them when the body isn't healthy. It's like the cleansing mechanisms in the body are not healthy. When we get them on a good, clean diet, and again, part of this, I think, is the immune system kind of wakes up. We're supporting the immune system. So the immune system says, oh, this stuff doesn't belong in the body. Let's get rid of it. Whereas before, it had just become kind of complacent. So now we're providing it with the proper support that it needs, nutritionally, especially, and eliminating all these other bombardments. Then it's like, oh, okay, this is what I'm supposed to be doing. This is, how a healthy immune system acts. And then it'll kick into gear and be able to identify the things that don't belong in the body and kick them out. And that dogs can detox through their skin. They'll get diarrhea, sometimes runny eyes and nose. Though they can detox through lots of different places in the body.
Yeah, absolutely, 100%. And when you go into, let's say, your conventional veterinarian and they're giving more medication, steroids or an immunosuppressant, you're really just, once again, trying to put a Band-Aid over the symptom, but you're suppressing the natural ability for your dog's body to heal the way that it should.
Absolutely. So less is more.
That's it. That's the tap of the show. Takeaway from the show.
Takeaway from today
is more. So any way that you can eliminate any toxin that goes in your dog and allow them to be healthy and allow their bodies to naturally be healthy, it does help. Go see your veterinarian. Go see Dr. Judy. Go, schedule a telemedicine appointment if you have questions or if you have concerns. Definitely, don't just remove this stuff and kind of shrug your shoulders and say, hope this works. No, definitely talk to a professional. Talk to your veterinarian about what you're doing and the strategy you're going for. And if they don't support you, there are many vets out there that will, like Dr. Judy. So thank you, Dr. Judy, for this week's show. This was eye-opening.
My pleasure. I think this is such an important topic because it can encompass so many different symptoms. And I think it's really important that we take the correct approach in treating it.
Oh, absolutely. So I hope everybody has an incredible day. Once again, thank you, Dr. Judy. I love our show. I think this is so much fun. And I hope all the pet parents that are watching got a little bit something from it. And if you want to contact Dr. Judy because you have some questions, right below in the show notes, there is her direct link to actually book a telemedicine appointment with her and have a conversation because your dog is so important. Okay. Thank you so much, Dr.
Bye,
Judy.
everybody.
We'll talk soon. See ya.
Okay.